All right, everybody, it's time to get started now, and appreciate everybody coming back after break and joining us. If you are planning on being in the pre-weaning session, you are in the right spot. If you're not, you're going to learn about pre-weaning livability for the next hour and a half right now. And so my name's Jason Woodworth. I'm one of the swine nutritionists at Kansas State University, along with Daniel Linares up here on the front. We're both the champions for this pre-wean pillar for this project. And so we'll have a very similar structure to what we had in the last session. We'll have 3 of the students that worked on some of the projects right here be able to come up and give some of their discussions. Then we're lucky to have Ashley DeDecker from Smithfield here as well too, to be able to give some of her inputs on what they've learned in their system. We'll then end up with a session of questions and answers and input and sharing the stories of what works on your facilities and your systems as well too. And so looking forward to that. Ultimately, we're going to end up today hopefully with a list of future trials and future projects that the industry thinks we should be focusing on as we continue this project into the future. And so be ready for any of those types of opportunities to give some input on what you guys want us to do on the next years and the future years of the project. But to get started right now, I'm going to introduce all 3 of our students and allow them to come directly up to the podium, one after the other. First off, we're going to have Abigail Jenkins. Abigail got her BS degree down at Mississippi State, went to North Carolina State with Dr. Flowers and got her master's degree, and ended up at K-State with us for her PhD. She did a tremendous job with us, and she'll highlight some of her work with big trials she did in conjunction with JBS. And currently, she's the Director of Nutrition at Tosh Farms, and so we'll look forward to hearing her talk. Mitch will come up next, one of Nick Gabler's students there at Iowa State. He's been doing a lot of E. coli work and gut health work he'll share with us. We'll finally end up with Mikayla Spinler. And so Mikayla would have got her undergrad at Iowa State University, her master's and PhD with us, just defended her PhD last week. And so if anybody's looking to hire a new nutritionist, she's open for the highest bidder at this point. And so we'll look forward to see what she has to share with us as well too. And so we'll queue up the first slide deck, and Abigail, if you can come and join us at the podium.
I'm excited to be here today to talk to you all about the effect of litter size relative to functional teat count and how that affects both sow and litter performance. So we know that the modern hyperprolific sow often gives birth to more pigs than the number of functional teats that she possesses. And this poses an issue to us, which we have 2 options in which to deal with that. First, we can either rely more heavily on nurse sows, but some of the things that we have to consider with nurse sows are that we ultimately have no chance of getting any more colostrum in those pigs that we put onto those nurse sows. We also have to consider that increased risk of disease transmission between our rooms when we move that sow from a room of weaned pigs to a room of severely immunocompromised newborn pigs. And lastly, from a practical standpoint, we have to leave some empty crates in farrowing houses and decrease our breeding targets to leave room for those nurse sows. So if we don't want to rely so heavily on nurse sows, then we have to consider what the impact is of allowing that sow to nurse more pigs than the number of functional teats that she possesses. How is this going to affect our pre-wean mortality? How is it going to affect sow body weight loss and subsequent reproduction? So that was the objective of this trial, ultimately, was to evaluate that effect of litter size relative to functional teat count on sow lactation measurements, litter performance, and subsequent reproductive performance under commercial conditions. We used a total of 1,005 sows on a commercial sow farm in Dalhart, Texas. These sows on average were a parity 3.5 and had a 22-day wean age. And we would have collected sow body condition measurements of body weight, caliper score, and back fat, both at entry into the farrowing house and at weaning. And we had 4 treatments for this trial, and they were all relative to functional teat count. So you can see as an example here on the right that is the number of pigs that sow would have if she had 15 functional teats for those 4 treatments. So the treatments were either 1 less pig than functional teat count, the same number of pigs as functional teat count, 1 more pig than functional teat count, or 2 more pigs than functional teat count. At the time, after cross-fostering and prior to weaning, pigs were individually weighed, both to determine performance and litter coefficient of variation, or that spread in body weight in the litter. It's important to note that any pigs born weighing less than 2 pounds were not included in this trial, as they were cross-fostered onto sows that received specialized care as per the normal SOP of the farm that this trial was conducted at. We only cross-fostered average body weight pigs in order to maintain that normal body weight variation in the litter, and no supplemental nutrition was provided to any of the litters in this trial. We blocked sows both by parity and functional teat count category, and treatments were balanced both on sow entry body weight and back fat. And I also want to make an important note that the entry body condition of the sows at this farm was incredible and very consistent, which made conducting this trial, at least from that perspective, relatively easy. And also, functional teat count determination and cross-fostering were performed by the same person throughout the duration of this trial. We analyzed this data in R and used sow and litter as our experimental unit, with the fixed effects of treatment and parity category, as well as their interaction being in the model, as well as teat count category. And before we can really get into the results, one of the big drive-home messages of this trial is that we really need to be on the same page about what a functional teat is. And so to really get down to that, a functional teat is one that produces enough milk to sustain the life of a piglet and is one that can be suckled by that piglet. So that means that any blunt teats were considered non-functional. Any teats behind the rear 2 legs were considered non-functional. Any teats not connected to mammary glands not producing a sufficient amount of milk, and then any teats connected to mammary glands with severe edema were all considered non-functional in the context of this trial. The way that we established treatments in this trial was that we tried to keep the litters as intact as possible with minimal movement. And so to go through how that was done, first, if we had these 4 sows as an example, we'd first want to move off any pigs that were born weighing less than 2 pounds onto that challenge sow. Then after that, we have to get the sows up to the correct number of pigs relative to functional teat count, where this light blue sow had 13 pigs born alive with 15 teats and was a +2 sow, so we needed to have 17 pigs, and she had 1 pig born weighing less than 2 pounds, so she would have to have 5 pigs cross-fostered onto her to get her up to the correct number of pigs. Our green sow had 17 pigs born alive, and she had 16 functional teats and was a +1 sow, so she should have the right number of pigs, but 2 of those pigs were born weighing less than 2 pounds, so she needs to have 2 pigs cross-fostered. And our purple sow had the correct number of pigs relative to functional teat count, and so we left that litter intact. So to begin, we'll first look at litter size and piglet weight on day 2. So once again, all these treatments were relative to teat count, and so as we would expect, we saw a linear increase in litter size on day 2 as we increased the number of pigs nursing relative to functional teat count. But we kept that average piglet weight across our 4 treatments the same. And so ultimately, that means that when we increased the number of pigs but kept that average piglet weight the same, we saw a linear increase in litter weight on day 2 as we increased the number of pigs nursing, which we expected. Getting into some of the data from this trial, first looking at removals and mortality from day 2 to weaning. The bottom hatched bars here are going to be the mortality, and the solid bars are our removals. And so you can see that there is a linear increase in removals and mortality as we increase the number of pigs nursing relative to functional teat count. However, it's important to note that the biggest increase between our treatments happened between that -1 and 0 treatment. In addition, the increase that we saw in removals and mortality did not happen at the same rate that we increased our starting litter size on day 2. Which ultimately means that we still saw a linear increase in litter size at weaning as we increased the number of pigs nursing relative to functional teat count, with those +2 sows weaning a pig and a half more than our -1 sows. However, as we looked at average piglet weaning weight, we did see a linear decrease in that average piglet weaning weight as we increased the number of pigs nursing relative to functional teat count. But it's important to note that all of these treatments on average weaned pigs that were greater than 13.5 pounds. And so these are still a very good sized piglet at weaning. However, that increase in average piglet weaning weight that we saw in those -1 sows was not enough to make up for the difference in litter size of the +1 and +2 sows. And so ultimately, we still see that increase in litter weaning weight as we increase the number of pigs nursing relative to functional teat count, with those +2 sows weaning a litter on average that was about 10 pounds heavier. Now, I told you that we collected individual pig weights. Myself and Sierra Collier had over 32,000 individual pig weights in this trial, and so that was a lot of work, but this is the chart that shows us the distribution of those piglet weights, and we can see that this is grouped by treatment. And when we look at those different body weight categories, you can see that our -1 sows did wean, on average, more pigs in that heaviest body weight category, so those pigs that are greater than 16 pounds. But if we just look at our 0 to +2 sows, we really don't see any major differences in that proportion of the litter weaned in those body weight categories, telling us that we kept that body weight distribution the same across our other 3 treatments. And then we talked at length about what these sows started at relative to functional teat count, but what did they actually end lactation at? We see those -1 sows, 47% of them weaned at 3 less pigs than functional teat count or worse. We see that that percentage decreases as we increase the number of pigs nursing relative to functional teat count, with only 15% of our +2 sows weaning at 3 less pigs than functional teat count or worse. And conversely, 48% of those +2 sows weaned at teat count or above, telling us that nearly half of those sows were still utilizing their full udder at the time of weaning. And that percentage decreases as we decrease the number of pigs nursing relative to functional teat count. From the sow perspective, we did see a linear increase in sow body weight loss over lactation. However, it's important to note that these differences in body weight change were less than 10 pounds across our treatments. And we saw the same trends both in change in caliper and back fat scores, where there were changes, a linear decrease, but the changes were relatively small. And so as we look at subsequent reproduction, first looking at the percentage of sows bred by day 7, we saw no significant differences across our 4 treatments and those percentage of sows bred by day 7. And we also saw this similar also in the subsequent farrowing rate. And interestingly, in this trial, we, in that subsequent litter, saw a linear increase in the live-born in that subsequent litter as we increased the number of pigs nursing relative to functional teat count. So as we package this all together and look at the pigs weaned per sow per year, estimated using a litters per sow per year of 2.43, we see a linear increase in that PSY as we increase the number of pigs nursing relative to functional teat count, with a difference of about 3.5 pigs between our +2 and -1 treatments. And so to conclude, the optimal strategy is ultimately dependent on the criteria that is of most interest. So if you want to optimize individual performance for the lowest pre-wean mortality, lowest sow body weight loss, and highest piglet weaning weight, then the -1 treatment was ideal. However, if you're looking to maximize farm throughput for the highest pigs weaned per litter, highest pigs weaned per sow per year, and highest litter weaning weight, the +2 treatment was ideal. As I wrap up, I do want to give a very sincere thank you to the JBS crew for their partnership with us on this trial, and in particular, the Longview 100 farm crew that helped us get this trial conducted, and in addition, our funding partners in this trial that made it all work. And so with that, thank you.
All right, good morning, everyone. Today, I hope to share some of our group's findings on pre-wean gastroenteritis and its impact on downstream nursery livability. There we are. All right, before I jump right into our findings on pre-wean gastroenteritis, I need to explain how we got here in the first place. So our group has spent a significant amount of time attempting to address the challenge that is transitioning an early wean pig into the nursery. And fundamentally, you guys know this, one of the biggest challenges is getting the pig on feed. So irrespectively, or invariably among trials, irrespective of dietary treatments, nursery study design, or the actual objective of the trial, one of the consistencies we've been seeing in nursery trials addressing these questions is gastroenteritis ubiquitously expressed throughout the population. I want to highlight a few trials before I jump into pre-wean data, but this was a 2x2 design with low crude protein or high crude protein, so a diet that theoretically could induce gastroenteritis in a population that's not assimilating protein well, and then with or without therapeutic zinc and copper. And to set this graph up, as well as graphs thereafter, this would be a scoring of tissue that is excised from the pig, so intestinal tissue, in this case, ileum tissue. And these tissues have been scored by a pathologist at the ISU VDL, blinded to treatment. And the scoring system will be this beige color will be no incidence of gastroenteritis or atrophy, lesions, or inflammation. And then the darkest color will represent a very severe score. So as you can see, with the use of therapeutic minerals, we are able to reduce colitis and enteritis in these pigs. So it is one success story. Another objective of a trial was to reduce coccidiosis in the nursery, because we believe that coccidiosis in the nursery is inducing enteritis, and this is causing downstream impacts to performance and livability. So we employed a study that was, again, a 2x2 design, low or high crude protein, with or without seleninomycin. It's a weak antibiotic and an ionophore. And what we found is we were able to reduce enteritis in this population at day 21, although we made very marginal impacts to colitis. I'm not showing it here, but we also reduced coccidiosis burden in this population. And we did a third trial in which we employed a few more pharmacology, being amprolium, sulfanoxylene, 2 coccidiostats, and amoxicillin, and we kind of found the same thing. We could reduce coccidiosis in the nursery, we could reduce enteritis, although we really made marginal impacts to colitis. So big picture, what I want you to take home from this is that from most of our studies, enteritis, colitis is quite prevalent in all of these populations. And we can make marginal changes to this, but we can't abolish the presence of gastroenteritis. So this led us to believe, okay, maybe all this action is metaphylactic, we're missing the boat. We need to hit these pigs in the suckling period, so we need to employ a targeted approach earlier. So what we did is we developed a study when we went into a sow farm, and we wanted to address the coccidiosis question, because again, this is a causative agent for enteritis in suckling and nursery pigs. So we employed a dual coccidiostat treatment, and then we had a positive control with pinazarol. And what we found is, by the end of the nursery, pigs were sacrificed at weaning, we found that we were able to reduce oocyst presence in the feces, we were able to reduce PCR positivity in the feces, coccidia oocyst presence in the jejunum tissue. We completely removed it with treatment of pinazarol or coccidiostats, although we did not statistically decrease mortality. But a big goal of this trial was not just to improve these indices in the suckling period. We wanted to follow these pigs into the nursery to see if we could improve downstream performance. So we followed these 1,000 or so piglets into the nursery. Before I share that, we also assessed jejunal enteritis, and we were able to reduce that. So one of the main objectives were successful. Colitis, we really didn't change at all. Now, one of the interesting findings of this study, and what we did not expect to see, is in the stomachs, there was severe incidence of gastritis at weaning. This is a 17-day-old pig, freshly weaned. And what we found is over half the piglets had either moderate or severe gastritis, irrespective of the medicinal treatment. And you can see there's a picture of a normal stomach here, and then a stomach that would be a severe score of gastritis. So you're losing these deep gastric pits, and it's hard to see, but there's more immune cell infiltration in this picture of gastritis. Okay, again, we wanted to follow these pigs in the nursery to see if we could improve downstream livability. What we did is we brought the 1,000 or so piglets to a nursery, and we sorted them by their suckling pig treatment. Then we sorted them or blocked them by body weights. And interestingly, what we found is that small pigs on the coccidiostat treatments observed reduced mortality rates compared to the larger pigs. Additionally, we saw the same tendencies with medical treatments. Okay, that's great. But we were really confused on the gastritis side. So we didn't understand if gastritis was an anomaly among this population or if this is a problem that we're facing throughout different populations, and is this a causative agent in the nursery enteritis and colitis we've been observing. So we needed to address this question by conducting a survey in which we went into a sow farm. We found 12 litters, and we euthanized litter match 1 pig per litter at 24 hours postnatal, 7 days postnatal, and 17 days postnatal. And then we did the same kind of gastroenteritis scoring we did previously. What we found is by 7 days, every single one of these pigs had some sort of degree of gastritis. In 17 days, it was even worse. And then enteritis followed, and we didn't see the severe colitis that we see in the nursery. But the point is, by 7 days in a suckling pig, we're observing heavy presence of gastritis in enteritis. In this cohort, the pre-wean mortality was 16%, and there was no association between gastritis score and weight gain, but I believe this to be an artifact of the dynamic progression of gastritis and all gastroenteritis diseases, as opposed to gastritis not having an impact on piglet performance or livability. We also swabbed the stomachs of these pigs, and we looked at the pathogen and pathogen-associated virulence factor gene abundance. And I'm not going to talk about all of these here, I don't have the time, but the big picture here is that 24 hours post-birth, pigs in this population had a high abundance for virulence factors associated with E. coli and Clostridium. Are they causative? We can't make that assessment, but it's an association. So what I want to leave you with is this is all really just, some of it was epidemiological, some of it was just survey. So I don't have the answers, but what I want you to take home is that we need to understand this problem because I believe it defines a lot of the downstream problems we're facing in the nursery. There's been a lot of talk about PRRS, but if you actually look at the difference between the PRRS population mortality and without PRRS population mortality, it's still quite high from the stuff Edison and Daniel shared. So there's a lot of other pathogens that are wreaking havoc in these pigs. So producers and academics need to collaborate and employ a targeted approach to characterize the etiology and pathogenesis of pre-wean gastroenteritis to help actually develop a study or a hypothesis and attempt to answer these questions. But I think I'm out of time, so that's all I got, and thank you.
Good morning, everyone. I'm excited to be with you all today to discuss the research that I did looking at split suckling. Split suckling is a strategy that's commonly used within the commercial swine industry, especially within large litters. And during split suckling, a portion of the litter is removed from the sow. That allows those pigs that remain on the sow to have decreased competition to consume colostrum, as well as greater access to that sow's underline. And really, when we think about split suckling, our overall goal is to ensure adequate colostrum intake for especially those lighter birth weight pigs or those pigs born later in the birth order, because we know the impact that colostrum intake has on lifetime survivability of our pigs. However, when we look at the published literature on split suckling, it does not indicate one best strategy that leads to the greatest reduction in pre-wean mortality. And actually, when we look at that literature, it's actually pretty limited. and it varies on how they select which pigs they remove during split suckling, how long those pigs are removed during split suckling, as well as how many times those pigs are removed during split suckling. So because of this, our overall objective of this study was to compare 2 different split suckling strategies on both pre- and post-weaning litter performance. For this study, we utilized a total of 1,500 mixed parity sows and their litters, and included just under 23,000 piglets in this study. We allotted sows and their litters based on parity to one of 3 treatments. Our first treatment was our control, and these litters were not split suckled. Our second treatment was split suckling based on birth order, and we'll call that our first 8 born. Our third treatment was split suckling based on body weight, and we'll call that our heaviest 8. And on the following slide, I have some animation that really display how we applied these split suckle treatments. Cross-fostering in this study occurred within treatment, after split suckling, and within 24 hours of the completion of farrowing. Now to move into our 2 different split suckling treatments. So our first split suckle treatment was based on birth order, and we'll call that our first 8 born. So as the sow was actively farrowing, we marked the first 8 pigs born in that litter. And then once the sow was done farrowing, and we counted her as being done farrowing, as when afterbirth was passed, we went in and weighed and tagged that litter. Then after we weighed and tagged the litter, we applied our split suckle treatments. So we removed the first 8 born pigs from the sow, and we removed these first 8 born pigs for 45 minutes. After 45 minutes, we placed those first 8 born pigs back on the sow, and then we removed those later born pigs in that litter, and removed these pigs for 45 minutes. After 45 minutes, the later born pigs were placed back on the sow, and that was the completion of the split suckle treatment. Our second split suckle treatment was based on body weight, our heaviest 8. And for this treatment, again, we weighed and tagged that litter prior to split suckling. Then when the sow was done farrowing, we removed the 8 heaviest pigs born in that litter, and we removed them from the sow for 90 minutes. After 90 minutes, we placed those 8 heaviest pigs back on the sow, and that was the completion of the split suckling treatment. We did not do any swapping and pull off those lighter birth weight pigs within this treatment. For this study, we took individual pig weights prior to split suckling and as well as at weaning. On a subset of litters, roughly 45 per treatment, we took a blood sample and a weight 24 hours after the birth of the first pig in the litter. Then we used that blood sample, spun it down, and pulled off serum. And we used that serum to measure immunocrit ratio. And immunocrit ratio measures the level of immunoglobulins in the serum of our pigs. So we can use immunocrit ratio to give us an indicator of colostrum intake, with a higher immunocrit ratio indicating a higher colostrum intake. For this study, we recorded the mortality of any pigs, including the pig ID, date, and reason for that mortality. We identified fallback pigs that were too small to compete with their litter mates for milk consumption from day 2 to 12 post-farrowing, and we recorded the date and weight when we removed those fallback pigs and placed them with the nurse sow. An important part of this study was really trying to understand if split suckling has an impact on lifetime growth performance or mortality. So we followed a subset of our litters into the nursery and the finisher to track lifetime survivability. To set up our slides here as a reminder of our treatments, our first treatment was our control, and these litters were not split suckled. Then we split suckled based on birth order, our first 8, or by body weight, our heaviest 8. It's important to note when we look at these pre-wean mortality numbers that I have presented on the slide, these would not include any pigs that died prior to weighing and tagging of that litter, and would also not include any pigs that were removed and placed onto nurse sows. When we look at pre-wean mortality from day 1 to 2 and day 2 to weaning, we do not see any differences among our 3 different treatments. We also do not see any differences when we look at the percentage of small pigs that were removed and placed onto nurse sows among our 3 different treatments. Because we did not have any differences in the percentage of mortality or fallback pigs, we had a similar litter size at weaning and started with a similar litter size at day 2 of the study. We observed no differences in average pig body weight on day 1 of the study, as well as at weaning. indicating that the split suckling strategies that we implemented in this trial did not impact pre-weaning growth performance. When we look at the subset of the population where we took those blood samples to measure immunocurt ratio, we do not see any differences among our 3 different treatments, indicating that the split suckling strategies that we evaluated in this study did not impact colostrum intake of these litters. As I mentioned, an important part of this study was really trying to understand if split suckling has an impact on lifetime mortality or growth performance of our pigs. So we followed a subset of the population into the nursery, split equally across our 3 different treatments, and then from that subset we followed in the nursery, we followed some pigs into the finisher. We were able to measure feed intake in both the nursery and finisher using Gestalt and EDAP feeders, as well as determine growth performance and feed efficiency by taking a body weight at the end of the nursery and then again before the first marketing event. When we look at the performance and mortality in both the nursery and the finisher, we saw no differences among our 3 different treatments, indicating that in the subset of the population that we followed, the split suckling strategies that we implemented did not impact lifetime livability of those pigs. Because we had a large sample size included in this study, we wanted to try and identify if there was a subset of the population where split suckling had a positive impact. So we looked at the interaction between treatment and parity, and we broke our sows down into 4 different parity groups: parity 1, parity 2, parity 3 and 4, and parity 5+. And we saw no interaction between treatment and parity, indicating that the response was not different based on sow parity. We also looked at the timing of split suckling by breaking our sows down and our litters down to those that were farrowed the same day that they were born versus those that were split suckled the following morning for those litters that farrowed late in the evening or overnight. And we saw no interaction between treatment and the timing that our split suckling was applied. We also broke our sows down into 2 functional teat count categories: those that had 14 or less functional teats or 15 or more. And we again saw no interaction between treatment and functional teat count. Another important part of this study was trying to understand the effect of split suckling in those larger litters. So we broke our litters down and pulled out a subset of the population, roughly half the litters included in the overall population, where pig count at day 1 was greater than functional teat count, or those sows did not have enough functional teats to feed all the piglets within her litter. And when we look at that early post-birth mortality from day 1 to 2, we do see a difference among our treatments, with those control litters that were not split suckle having a higher pre-wean mortality from day 1 to 2 compared to those litters that were split suckled based on birth order, with litters split suckled based on body weight being intermediate. However, when we look at overall mortality from day 1 to 2, we do not see any differences, significant differences among our 3 different treatments. However, those differences that we saw from day 1 to 2 were maintained throughout the pre-weaning period. When we look at the reason for mortality in those control litters in that early post-birth period from day 1 to 2, there was a higher percentage of pigs laid on during that post-birth period. So overall, when we look at the overall population included in this study, we did not see any differences in pre- or post-weaning growth performance or mortality due to the split suckling treatments that we applied. So this begs the question, if we're not having an impact on pre-wean mortality by split suckling, are there better ways that we can invest our time to improve piglet livability? I would like to thank DNA Genetics and Pill and Family Farm for their collaboration and use of their pigs and facility in this study. And I would also like to thank the National Pork Board and Foundation for Food and Agriculture Research for their partial funding of this study. Thank you.